Happy Monday, folks. Welcome to another edition of Cape Ann Today. Heather and I have a great interview for you. We spoke with Karin Carroll. She's the director of Gloucester's Health Department about a multitude of issues and to see how the city and the state is in dealing with COVID. Check it out.
Karin, how have you felt about the phase 3 openings of restaurants inside and outside? How has that gone in Gloucester?
I think it's largely gone really well. It's great to see these businesses back open. We've had a lot of questions, but we had a lot of task force reopening meetings with the Chamber, Discover Gloucester, our food inspector, our economic development and community development. So they did a lot of neat planning, problem solving together. I'm sure you've seen the downtown. It looks great with the little outdoor cafes. And largely it's gone really well. We're hearing restaurants are busy, people are happy. And I think the couple issues that are coming up is they're having trouble getting, enough staff back on deck quickly enough, which is good too, to have jobs in the community. And also the compliance with the face covering, I think, is still a challenge. And, the businesses are handling it the best they can, trying to require people to wear their face covering when they come in through the main part of the restaurant. Once they sit down with their party at their table and they're eating, they're not required to have it on. But we have had some compliance issues with that and people not, adhering to that or wanting to adhere to it. But not a lot of issues either. So we're working with businesses and giving them strategies for how to handle it. And at the end of the day, there are a lot of people who cannot or won't wear a mask. And I shouldn't say a lot. I mean, there are a few people who, for medical reasons or personal opinion, cannot or will not wear a mask. And I think we just need to recognize that and have those people maintain that social distance and concentrate on those of us that can and do, and how every little bit, every person wearing it will help protect the virus. So most of us, most of the time, that's what we're aiming for.
Great. And how about our senior care facilities? How are they doing it, now that there's been a lot more attention on how they can manage internally?
Yeah, they're doing really well at the moment. We still have daily communication with our nurse team and the managers of our long-term care facilities in town, which is fabulous. We can know what's going on, what issues they're struggling with, what their caseload looks like. And we, have constant dialogue and communication. And when we need the advice of an epi at the state, we bring those people in. At the moment, it's very quiet. Community transmission is low everywhere. And that's both within hospitals, long-term care facilities, and businesses and homes. So we're in a place right now of low activity, low community transmission, less than 5 active cases in the community right now. So these are all really good things. And the long-term care facilities are enjoying that same quiet of less cases and less illness in their facilities as well.
Karin, do you want to talk about school preparation now? I mean, there hasn't been an official word yet, but that date is getting awfully close.
Yeah, I'd love to. I've had the pleasure of going over to meet with the Gloucester Public School principals and senior management team earlier in the week. They're doing a remarkable job just diving into the guidance that's coming out from DPH and DESE and these state organizations. The guidance is coming fast and furious, like with every other part of this COVID experience. The guidance, changes, it gets fine-tuned. And thanks to people like that who are really diving in and saying, well, what is recess going to look like? And how can kids safely eat and be at the art table or whatever? So it's great. We had a lot of questions we couldn't answer ourselves. We're bouncing them back to the state. We're involving the public health task force that the state has set up of interns and public health faculty and staff. They are still available to us, which is phenomenal. So they can help research. They can sort of scan the literature to see maybe what schools in Australia did to keep kids safe at recess, or what we can learn from other people. What's the science say? What's the best practice? So that's a great partnership. That's where public health feels like we can really partner with people in the community, like our schools and councils on aging, to support them in the monumental task they have ahead of them. And you know, everybody won't like all the decisions. We don't, you know, the guidance comes out and it changes, and some of it feels odd or strange, but the guidance is there, and you know, we're working through it. And I think they're doing a great job. It's a hard task, and I know it's unsettling. We see the same level of anxiety around returning to school that we saw with people going into nursing homes working, or janitors having to clean in hospitals. You know, it's the same thing. It's just a whole new industry that we haven't dealt with yet, except for very early stages of the pandemic. So we've come a long way. We know a lot more, but it's still really hard. It's very uncertain and unsettling. I think schools are trying to offer options for people, and that's great. You know, if there can be some flexibility and options. So yeah, we've told the schools they're priority one for the health department and our team. And Superintendent Loomis has joined us, our weekly COVID task force calls. So he can be connecting with other people in the community that can support him and raise up issues as he needs them. So we're working really closely with them, and we're excited. I mean, we really want to try to get these kids safely back to school some of the time for as long as we can. And you know, what we also explain to parents and the public is right now, community transmission is low. So it's about minimizing the risk. If we wear face coverings and we follow the guidelines and we go back now, hopefully we'll be good. As things change, which, you know, a lot of us are fearful as the winter months come and flu hits, there's very likely to be more cases of COVID around. But, you know, I think we'll work in partnership. We'll be monitoring that really closely. And, you know, you don't go from open to shut. You go from monitoring low community transmission, you open, and then if you start to see more transmission, you pull back, you keep kids further apart, you maybe reduce the number of days they're in school, you know, whatever your policies are. But we have some tricks we can use, and we get a little stricter. And then, you know, if we have to at some point, of course, the schools will close back down, as we saw in the spring. But, you know, we'll try. I think there's a lot of things we can do. And right now, with community transmission low, it's a positive sign.
How is the visitor situation working on Cape Ann? The fact that we have out-of-state visitors arriving here to enjoy this beautiful place. How is our health department looking at that?
Yeah, I mean, the main places where visitors would come would be hotels. They do a good job. They have to inform visitors when they arrive if they're coming from one of the states beyond our 8 area immediate states. They are instructed to quarantine for 14 days. I don't know how many visitors we get from those places. I mean, we've all seen out-of-state places around when we drive around. But I don't know that I haven't heard that there's flocks and droves of people from, you know, the Midwest or the South. I think, you know, the New England states right now are in pretty good shape, and the governor did extend you don't need to quarantine if you're coming into Massachusetts from one of our New England states or New York or New Jersey. So that made it a lot simpler for people to go on vacation and feel like they could safely come back to Massachusetts and or come here to vacation from those other states. So it's really just when people come from a distance, and we do have cases where people go out of state by car or plane, and when they come back in, they're advised to quarantine for 14 days. And we really encourage people to do that, especially if they're coming from an area with a lot of transmission and parts of the country where we are seeing more transmission. So the only way in which the health department gets involved on a regular basis, I mean, we certainly answer lots of questions on this and give the advice, but it's when, you know, there are crews or tours or things that might start to want to come to Gloucester, that's when we would have a conversation about, you know, where are folks coming from? Have they quarantined? What would happen if someone on the cruise or the tour got sick? So those are the kinds of things we would spend a little more time with, and we have met with some of those companies, but at this point, those plans are a little bit on hold. In general, you know, I haven't heard it's a problem. A lot of people who come here come for outdoor things like our beaches and parks, and you know, so there a lot of the activity this time of year would be outdoors anyway.
Or you have anything else?
Yeah, Karin, I just want to ask quickly your thoughts on Happy Valley, the marijuana dispensary opened up, and did the city have to work with them in any way to help get all the permits done, et cetera, to get them up and running?
Sure. Yes, we did. I mean, it's quite an extensive process to get permitted to sell recreational or medical marijuana. That facility has a permit to do both. And last week or the week before, very recently, they opened their retail shop for the first time. I think the opening went well. I was not there. Our department has to do some initial permitting, yes, and there are public health regulations for any marijuana establishment around youth access, around food safety, and there's a permit you need from our health department. So we have been working for a long time with them to go through those steps once they got their CCC permit from the state, and they are in compliance with that, and we issued that permit a while ago, so I'm not sure. And basically it involves our food inspector. When they were ready to start any food production or kitchen work, we would go and inspect that like any other food establishment. And as far as I know, they are open and running, and you know, it's going well. I haven't heard that it's not. Can I just mention one more thing about case and probable cases? You asked earlier about infection rate, and we are at sitting on well under 2% and have for a very long time as a state. So that means of all the people tested, less than 2% of them are positive. So even when we tested lots and lots of people statewide after many of those protests, there was free testing throughout the state, you might remember. And you know, when even after we had that large amount of testing of people who had all come together, we still had very, very low rates of positive numbers. So there are very few cases. What we are seeing more is more contacts and more people. And now that we've expanded criteria, there's more people that just want to get tested or need to get tested for some reason, or they're going to Maine, so they need to test. So we are still seeing, you know, that we definitely still like more testing. We'd like more rapid testing, and we'd like more testing on Cape Ann, but the positive number or percentage is very, very low. So that's a good thing, both locally and on the state level. The other thing that happened recently this week in Gloucester is just a standardizing of how we count COVID positive cases to how the state recommends communities count it. So we added what's called our probable cases. These are cases that were never tested, maybe back in the early day when they couldn't get a test or they were too sick or whatever. They never got a test while they had the active virus, but at some point later, they took an antibody test and that was positive. So it showed that they did at some point have the virus and they've developed antibodies for it. So we count those people now, and there's about 30 in Gloucester, or 25, that we consider probable. And so we now add those to our numbers of confirmed cases. It doesn't change the picture here in Gloucester much at all, but it's just important for people to understand that if you do get tested and it's shown by an antibody test that you did have COVID at some point, we want to know that, and we want you in our database, and the state does. So they've added them into our database.
What is the criteria for identifying someone who might qualify for an antibody test?
I believe anyone can get an antibody test if you're willing to pay for it. There may be some insurances that will cover it in certain scenarios. The problem is, it still doesn't tell us enough. It doesn't tell us when you had the virus. It doesn't tell us if you're immune. So we can't do much with it clinically alone. So a lot of people will get the PCR test and the antibody, and so that gives us a little more information. If we know you're not active and you've got immunity, then we can make some other correlations about return to work or return from quarantine. But generally speaking, the State Department of Public Health, we can't do a whole lot just with the antibody test yet. We don't know enough about it. We don't know how long it means, if it means you're immune at all. I mean, we have people who have gotten COVID again, so they don't really understand if that's like a resurgence of the first case or a whole new case.
So you've seen that, actually, someone who's had a resurgence, or it seems as if they've had it twice.
We have seen people that we've struggled to clear, but I don't know that they actually had symptoms twice here in Gloucester. But we have seen it on a statewide and a nationwide basis. Yes. Yeah.
I'm a little curious that you don't hear anyone talking about how great things are in Massachusetts on the national news, in any sort of national news story. It seems like we should be bragging about this, that we've done a very good job.
I think so too, Heather. I think we should. I think we're all just so cautious. You'll hear Governor Baker say, "No time for a victory lap, team," and yeah. We feel that way. We're really so thrilled that there's low transmission right now, and we're not seeing the level of sickness and disease and even the deaths we saw in Gloucester. We're not seeing that, and it's a huge relief to us and our team, but we don't feel that we can let down our guard. We know enough about this very contagious virus, and Massachusetts was kind of a hotspot for a while, so it's, you never know how it's all going to play out. And I think, but you're right. I mean, I think the governor has done a really good job with the guidance that's come through. And when it does feel unclear to us or we're worried, they listen to input from local communities, boards of health. We have twice a week, we speak to DPH on the phone. We can ask questions. And the governor has had a really thoughtful, slow reopening. He's watching those indicators, his team is. And so, yeah, I mean, I'm really hopeful that Massachusetts is going to come out just, really doing well with this and being a model for how we can stay functioning, stay open in some kind of normal level through COVID till we have a vaccine.
A last question for me.
Yeah.
Could you put your finger on 1 or 2 weeks where things really changed and why? Where you were seeing an action on the part of the state and the city that was really making a difference, and you began to see a turn. Can you identify a moment or an action?
Yeah, and there's a lot of research that can too. The moment we shut down in the spring and we got people away, there's this sort of hierarchy of dealing with infectious disease, and the first tool and the most effective is just eliminate the pathogen from it, So by literally putting us in our homes separate, we eliminated the ability of the virus to move through a community because it needs other people. So it was just, so definitely. And that is the point in which we saw some trends start to change and come back eventually under control. Other than that, I think that our decline in this spring has been all the measures we put in place, as well as people being outdoors. There is very little transmission outside that happens. So I think that's part of it. And again, the biggest thing that we keep saying, in addition to face coverings and all of that and distance, is that when you are sick with any of these symptoms, know them and stay away. We can't say it enough. And our nurses who have to deal with the family or the company or the whatever that is, you know, there's a lot of havoc wreaked when you have a case in your facility or in your family. And so if we can just avoid that as much as possible, especially coming back to school, we're going to try to do as much education as we can, that if people don't feel well, and we've done it with the city, if you have any of those 8 symptoms, please stay away. And it's really, really important. That's how we're going to manage this thing. If people come in with the symptoms, and often they don't think they have much of a symptom, but after our nurses get done really grilling and asking questions, we see, yeah, there were some symptoms there that they might not have realized were COVID symptoms or didn't think were significant enough. So we just really keep hammering that message. It's not the time to be a hero and, you know, get in there to work. If you're not feeling well, anything questionable, have some work to take with you so you're ready to go at home that day and see how it goes.
We always love talking to Karin Carroll. It's so great to have her access so that we can learn about the day to day, what is happening with the virus in the city.
It was interesting how the city and the state are hesitant to beat their chest about the success of how they're dealing with COVID, but also, like, I don't think the city or the state wants to flash a neon sign, you know, to the rest of, you know, the area or the country, like, hey, yeah, no, seriously, we're dealing with that. So anyway, great stuff from Always as Karin. Tune in for the rest of the week. Heather and I have a lot of really cool stuff to share with you, including another long chat with State Senator Bruce Tarr. And Kim Smith is back with more beautiful imagery and a discussion about piping plovers. See you soon.